So welcome everyone. Really excited to have everyone on the call today. So my name's Julia. I'm the association coordinator with the PEI Lung Association. This is our second COPD virtual support group session. So we're going to be offering these hopefully about once a month, and each month's going to have a different topic. So our first one was more of an intro, what is COPD? And today's session is staying active with COPD. And we have two speakers on the call today. So we have Francois Caron at the Department of Health and Wellness, and we have Courtney Phillips, who's a physiotherapist with the Health PEI Pulmonary Rehab Program. So how it's going to work is I've muted everyone for the speaker portion of it. And so we're going to introduce our speakers, have them do their presentations, and then at the end of the session, we're going to allow for some time for some question and answer. So this group was generally created because we know that COPD can introduce many challenges in your life, and we hope this group will provide an opportunity for you to connect with others living with COPD, ask questions, receive expert advice, and learn some skills to manage your condition. We've also created an online Facebook group that's going to go along with this program. And the Facebook group will help participants continue the conversation offline. So we're going to post some questions, to help people communicate with each other, but also just share, how you're managing your COPD, some of the challenges that you might have in your life. So although the PEI Lung Association is the host organization for this group, we really want this group to be about what you want, and we're really open to feedback. So please feel free to reach out to us by phone or email to let us know topics that you might be interested in seeing in our new group. So I think we're ready to get started. I'm just going to make sure nobody else is on here. With the format of our presentation, we are going to hold our questions to the end. That would be great. Okay.
Great, thanks, Julia. And actually, this is going to be a low-tech presentation. I don't have any slides to share.
Oh, okay.
I'm just going to share some
No
tips and ideas. And if you want, once this is finished, what I can do is kind of put together a little outline of what I spoke to and send it to you, and you can share it with your group if that's beneficial. Interestingly enough, you did a wonderful job on the radio this morning promoting this session, and I was in my basement finishing my workout while I was listening to it. So, it kind of talks to the importance of being active and finding ways, particularly in the new realities of COVID, on how to do this. What I hope to touch on today is three key points. One is what the current situation is in PEI around physical activity and some of the things that we've seen related to COVID. Two, what the physical activity guidelines, and three, some tips and tricks on maybe how, if we want to add some more activity to our day, how to do so in such a safe way. So first of all, in PEI right now, about 1 out of every 2 islanders are meeting the Canada Physical Activity Guidelines. So only about 50%, and that's regardless of whether or not they're dealing with a chronic condition or any other situation in their life. And so that tells us that, being active and meeting these guidelines isn't as easy as it sounds. Putting on a pair of sneakers and going out and being active for 30 minutes a day seems like a fairly easy task, but if it was such an easy thing, 100% of the people would be doing it. So we do know it's a challenge. We also know that once someone is dealing with a chronic condition, it becomes even more challenging because there's additional factors that are mitigating our opportunities to be active. And so I always like to declare up front, I'm coming at this as someone who's not dealing with any lung issues. I don't have COPD, and so my lived experience is completely different than our audience today. However, for the last 6 or 7 years, I've been invited to the pulmonary rehab programs at UPEI and in Summerside, and have delivered dozens of presentations and have learned an incredible amount about these challenges from the participants. And so some of those things I'd like to share today as well. We do know that there are many benefits to being physically active, and we're talking about moving our body for engaging our systems. And so when we move our body, our heart rate increases, our breathing increases, we engage our muscular and skeletal systems, and all these systems being engaged leads to better and optimum health. Over the last number of years, Canada, with a number of other countries, had created the physical activity guidelines. And what those guidelines currently state is that islanders or Canadians, adults over the age of 18, and older adults are very similar, should be striving for 150 minutes of moderate to vigorous physical activity each week. And so if we break that down into smaller points so our audience can understand what those guidelines really say, is first if we look at the time. So 150 minutes is 2.5 hours of physical activity. Now that can be broken down into parts. So we could do 5 days of 30 minutes. We could do 15 sessions throughout a week of 10 minutes. We could do, if we can only handle 2 or 3 minutes, we do those and we add up. We know that with physical activity, once we start engaging our system for 10 minutes at a time, that's when we start to get the optimum health benefits. But if your audience doesn't listen to anything else I say today in great detail, remember this: some activity is better than none, and more is better than some. And we know that some people, it is just physically impossible to try and get 10 minutes of consistent, continuous physical activity because of their situation. But that doesn't allow them to say, I'm not going to do anything. If you remember, we can start adding up our minutes so that over time we get as many minutes as we can over the run of a week, with the goal of trying to get that 150 minutes. Okay, so that's the first part, is the time. The second part is moderate to vigorous. What does moderate to vigorous look like? Okay, and it looks completely different to everybody. Even folks dealing with lung issues, it may look different for one person versus another. And so the way you know you're working at a moderate to vigorous level is you start moving your body and you feel it getting warmer. You may start sweating, but some people don't sweat quite as easily, so it may not be a sweat thing, but you do feel yourself getting warmer. You also feel your breathing getting enhanced. And we know that based on my conversations with many people with COPD, that happens very quickly, right? And so the breathing and the challenging with breathing kind of gets ramped up. But we're still able to carry on a conversation or have a talk with someone, and that tells us that we're not overdoing it. We're not beyond that moderate to vigorous level. So if I'm out for a walk with someone and I can't catch my breath because I'm probably doing too much at that point in time for the moderate to vigorous. I've probably now moved into a vigorous. So you really need to listen to your body for that part. So we get 150 minutes of moderate to vigorous activity. And the other part then is the types of activities. So the majority of the time we want to be doing cardiovascular endurance activities, those activities that raise our heart rate and keep it raised over a period of time. So going out for a walk would be a great activity that gets our heart rate up and then it stays up over a period of time. Depending on people's situation, a chair exercise where I'm doing toe taps. Again, I'm not engaging my whole body, but by moving my legs and my feet up over a period of time, my heart rate increases, my breathing increases, and so on and so forth. And so most of the days of the week, we've got cardiovascular endurance. And then a couple of days of the week, we want to make sure that we're doing muscle and bone strengthening activities. So moving some sort of weight through a range of motion. And that doesn't necessarily mean we need to go to the gym and lift weights or stay at home and use dumbbells and barbells. We can use lots of different things in our home, soup cans, pantyhose, resisting bands, those types of things allow us to do that. And so then you couple all that together, and if you can kind of meet those, then what you're doing is setting yourself up for the best optimum health possible. It doesn't give you immunity for any disease or any issue, but what it does is put the odds in your favor that you're investing in your own health through being physically active so that you give yourself the best chance to live the best quality of life as long as you possibly can with all the other things going on. And so generally that's what the guidelines state. And so again, some activity is better than none, more is better than some. So if I can't get that 150 minutes, then 30 minutes is better than none of it. And then if I can build that over time, then maybe I can raise that up a little bit more. The other thing to keep in mind is that sometimes with activity, the goal isn't increasing what I'm doing, but maintaining my current situation that I have. And so in some cases, as we get older, as we deal with chronic conditions, sometimes it becomes challenging to do what we've always done. So it's lots of hard work just to maintain what we currently have now, as opposed to regression and going backwards. So let's try and keep that in mind when we're thinking of those guidelines. And again, I can share the guidelines as well as kind of a few notes from this presentation afterwards and circulate it to the audience on the Zoom call today. So those are the guidelines. The next piece of this is, what do I do and how do I add activity to my day safely? We are in optimum New Year's resolution time. This time of the year, regardless of situation, lots of people are making the decision that this is going to be the year that I'm going to try and change my lifestyle and add activity. And generally what happens is we try to do too much, too quick, and we set ourselves further backwards. So the story kind of looks like this. I sign up for a gym. because it's January 1st and I've just overindulged over the holiday season and I want to kind of get out and do my thing. And then I start doing it. I feel really good about myself for the first week or so. I've been getting up, I've been following what I said I was going to do. But on day 4 or 5, something called lactic acid kicks in because we're using muscles and parts of our body that we've never used in a long time, and things start to ache. And then all of a sudden we look and say that, you know what, it's a little bit darker, it's a little bit colder, and it's a little icier, and we decide that we're not going to continue with our program. Right? And so we kind of create a situation where we're setting ourselves further back because not only now are we not doing the activity, but we're beating ourselves up psychologically because we said we're going to do something, we started to do it, we didn't do it, and then we quit. And then you kind of create this cycle. So what I like to say is let's add or maintain our activity very intelligently. And so it could be that if I'm deciding that New Year's is the time I want to do something, I'm going to go out and I'm just going to do a little bit based on how my body feels. And so maybe that could be going out for no more than a 5-minute walk. And for some people, 5 minutes may be too much. It may be 2 minutes. But we pick that base starting time and see how our body feels after doing that for a week. If we walk, 5 minutes in the morning and 5 minutes in the evening, and I do that 3 or 4 days in the week, now I've got 40 minutes. And I listen to what my body's telling me. Is that okay? And if it is okay, then I start adding very safely. And we add through something I call the rule of 10%. We never add more than 10% of our dose week over week so that we allow our body to build the stamina and the endurance to carry out that activity that we're doing. So let's say the first week of January, I've decided that I'm going to do that 5-minute walk. If I feel okay at the end of the week, then I say, you know what, next week I'm going to add 10% or 30 more seconds. And I jump to 5 minutes and 30 seconds. I do that for another week and then listen to my body. And then if I continue to feel like adding, I keep adding that way. And it's kind of like compound interest. After about 8 weeks of this, you've doubled your time and you've done it safely, as opposed to jumping in, doing too much too early, injuring yourself or quitting because it's not something that you're enjoying or it's too much of an effort to do it, and then set yourself backwards. The real key to that, and it particularly deals with people dealing with a variety of chronic conditions, is listening to your body. What is your body telling you, right? And if it's telling you that you're doing too much, then maybe you need to back off the dose, but then you can do more sessions of that dose in a day. So if 5 minutes is too much, then maybe I go back to 2 minutes. But maybe I do 2 minutes at 9 o'clock and 2 minutes at 11 o'clock and 2 minutes at 1 o'clock. And eventually throughout the day, I still may get my 15 minutes, but instead of doing 3 sessions of 5, I'm doing 7 sessions of 2, 2.5. And so that listening to your body part becomes a very, very important piece. Because the golden rule of physical activity is you want it to benefit you. You don't want it to do any more harm for you. And so you want to set yourself up for success that way. This is kind of, I'm used to presenting where the kind of people are asking questions and you can kind of read the room. So hopefully everyone's still going here. So if I choose to want to start adding activity or maybe looking to increase what I'm currently doing, what are a few tips and tricks to do this? One suggestion I have is figure out who your support team is and let them know what you're doing and then ask for their support. Again, when I go back to my first statement, if physical activity and exercising was easy and everyone understands what the benefits are, then the majority of people would be doing them. But what we find is that that's not the case. And so if it is something that's challenging, I need to have as much help as I can. And so what does my support team look like? Perhaps if I'm in a working environment, it's talking to a coworker and saying, listen, are you able to cover the phones for me today at break time? Because I'd like to get out for a 3 to 5 minute walk. Or perhaps it's talking to your manager saying, can I extend my lunch break by an extra 10 minutes because that's the only time I can be active? Or perhaps you have a child who lives in another province and you say, listen, will you text me every day and say, hey, Dad, how was your walk? And it's just that little piece of accountability that kind of keeps me on my toes and encourages me to do my thing, right? Creating that support team so that when you are doing it, you have the group of people kind of holding you up as opposed to someone saying, oh, look, they're going to start their New Year's resolution again. I wonder how long this one's going to last, right? And so you try and put that group in your corner, right? Support group is so important. The next one I suggest is test driving. Find an activity that you enjoy and test drive how it feels at different times of the day. And we know that that's the reality with people dealing with lung challenges. There might be certain times of the day, there could be certain temperatures, there could be certain wind directions, a whole variety of things that impact our ability to get oxygen while we're outside being active. And so have your little journal out and note, I've gone for a walk this morning, this was the weather, and felt pretty good. Went in the afternoon, the same weather, and didn't feel quite as good. So maybe I've realized that morning is the best time for me to do those activities. Or maybe I know that from a certain temperature to a certain temperature, I just can't do it because I just can't get my oxygen in, and it's just too much of a challenge. And so by test driving, you're trying the same activity over a different variety of times and locations so that it gives you a sense of what works for you and how you feel doing it. Similarly, you could test drive different activities. Are you able to go for a walk on a road versus in the woods? And does the up and downs impact you? Are you able to use walking and bowling as an activity or something around that effect? And certainly with COVID, the challenges of getting out and test driving in community programs right now aren't the same as what they were pre. But perhaps another thing with test driving is you don't test drive once. In 6 months' time, you test drive again and see what activities and what times impact you, and then kind of move on that way. And so you get this variety of activities that maybe help with a little bit of cardiovascular endurance and strength activities at the same time. The next suggestion is, if you're social, find someone to do your activity with, but make sure you lay out the terms to them before you do it. And what I mean by this is the following, is let's say I have a neighbor who often I see going out for a walk and we're good friends. And I go out and ask them, say, listen, I want to start walking. Would you walk with me? And the first time we go out walking, she's walking at 10 kilometers an hour and I only can walk at 2 or 3 because of my condition. It's not going to take very long for that to be a negative experience for you. So the conversation has to be, you know what, I'm trying to get back into walking. I know that you're an avid walker, but I'd really like to have someone walk with. Would you be open to going out for a walk with me for 3 or 4 minutes for the first part of your walk? But we've got to walk at my pace. And if I say that I need to kind of stop and have a break, then we need to stop and have a break because that's the reality of my situation. If we don't have those conversations up front, then we always have this negative self-talk in our head that, I can't keep up, or this isn't what I kind of had in mind. And so you need to be creative on how to do that. And one of the neatest examples I heard was one of the first presentations I did is a husband and wife, and they generally walk together all the time. And what they ended up doing was, so that they could maintain their walking ritual together, is they set up a few lawn chairs around their lane. And they would go out and walk. And when he got tired, he was a gentleman dealing with lung issues, he would sit in one of the chairs. And then she would continue doing her walk. And then once he was ready again, he would jump up and then she would join him again. And that's how they maintain that. So again, having that conversation around, what are my terms to make this positive for me? Because we can be a little bit selfish when it comes to our own health. We can say this is what we need and these are the supports that we need. Finally, if you're a goal setter, set some small goals, but then reward healthily. What we often do in health promotion is we say we're going to do something, and then once we finish it, we reward ourselves with that treat or that favorite snack that may not be the most healthiest. What I suggest is we try and create a lifestyle change. And so if I'm going to say, you know what, for the month of January, I know it's going to be very cold, that maybe I'm going to create a route in my own home where it's going to be a 2-minute walk where I go from room to room, in and out and around, and do that sort of thing. And if I'm able to do that kind of 3 times a day for 5 days a week for the month, then I'm going to reward myself and perhaps buy a nice pair of walking shoes or a shirt that's a dry fit shirt that kind of makes me breathe while I'm exercising and doing that sort of thing. One neat example I heard of a rural lady who it was very dangerous outside her property to exercise is on laundry day, she would put each article of clothing away one at a time. And so that kind of created a little walking tour through her house where instead of one trip with 10 shirts, it was 10 trips with 1 shirt each time. And it just created a time to be active. So it wasn't quite as boring as just walking around their place. So again, creativity comes into this whole physical activity thing. So I guess my big message to the audience is some activity is better than none. More is better than some. Start small and grow safely by following the rule of 10%. And you're okay to be a little bit selfish when it comes to investing time into your own physical activity, because it is something that you can start to try and put the odds in your favor to live the best, healthiest life that you can within the current circumstances that you're dealing with. With that, I think I've used my 20 minutes or so, and so I'll stop there.
We're not hearing you, Julia.
Okay. Okay. Thanks again to Francois. That was a great presentation. I definitely found it motivational. I think this is a really hard time of the year to get out and about. But I think that, like you said, there's lots of ways we can be creative and find ways that work in our lifestyle. So we're going to pass it over to Courtney. You do have control, Courtney. So I'm just going to pin her post, and then she's going to upload her slides. Okay, so I'm just going to introduce Courtney Phillips. So Courtney graduated from Dalhousie University with a Master's of Physiotherapy and began her career in acute care in Halifax. She moved to PEI in 2016 and shortly after started working as a physiotherapist with the provincial cardiac and pulmonary team. Courtney is also an avid cyclist, and in 2020, she actually won Cycling PEI's Senior Female of the Year. So congratulations, Courtney. We're looking forward to your presentation. Go ahead when you're ready.
Thank you. Well, thank you very much, Julia. So I just want to make sure, is everyone able to see the screen? It says staying active with COPD. It's the big screen there. Julia, can you confirm that?
People are nodding, yep.
Okay, very good. All right, so yes, thank you, Julia, and I'm really excited to come and speak here today. And Francois, it's always great having him come do a presentation because it's all very realistic. And being in the pulmonary rehab program, we really relied on such great guest speakers. So I'm here today, and here are a few things that I would like to talk to you guys about. So why should someone with COPD exercise? And even capitalizing on what Francois was saying, how much exercise? Then we'll go over some of the steps to being successful and how do we adapt our exercise if we find that we're in a COPD flare-up of our symptoms. We'll also go over some of the normal and then abnormal symptoms that you may or may not feel during exercise. And we'll also go over some of the common barriers that can interrupt someone's exercise routine. And maybe even we'll be able to go into our question period and have some discussion on that. So the one thing with COPD, why should someone exercise? And one of my first things is that it actually helps to better control your shortness of breath. And so a few of you guys today are probably thinking in the back of your minds, Courtney, I don't know how you think that I can exercise when I'm already short of breath. And I get that question a lot. So the answer is that there are a lot of factors that can help with controlling your shortness of breath. And one of those is actually regular exercise. So over time, as we engage in regular exercise, our body becomes more efficient at using the muscles for breathing. These muscles can become stronger and they may not fatigue as easily. So overall, our whole body becomes more fit, but that is how we can better control our shortness of breath. Now, exercise also helps increase strength. So as Francois said, strengthening sessions are also important and recommended. And by being more active and engaging in those strength programs, this will translate into your daily activities. So things might become a little easier. Climbing the stairs might be easier. Going to the grocery store or doing the daily tasks will become a little easier. And we know with having a chronic lung condition, that experience can come with a lot of anxiety and even feelings of depression. One of the ways to help curb those feelings is actually to engage in regular physical activity and exercise. And the reason behind this is that as you exercise, your brain releases these feel-good endorphins that help improve your mood. They make you feel more energized and happy. And additionally to that, that feeling of accomplishment after you've completed an exercise routine or done your workout for the day, or you know what it may be, that accomplishment gives you that sense of confidence and to do those tasks, and maybe that helps participate in other events that you previously might have shied away from or avoided completely. And my last point is that just almost speaking globally, not just to those who have a chronic lung condition, but to everyone, that I feel like the best reason to exercise is that it improves quality of life. So meaning that it provides you with that ability to participate in things that you love and enjoy events in your life. All right. So the exercise recommendations, all those good things that we talked about on the previous slide, you have to put a little bit of what I'm going to call some sweat equity into and participate in the daily physical activity. If you're just starting out exercising, then one of your long-term goals could be to eventually build your way up to doing more, doing some form of physical activity every day. And like Francois said, you start where you start, and you start little and you move your way up. So the Canadian Physical Activity Guidelines, just like Francois said, yeah, they recommend at minimum 150 minutes of cardiovascular exercise per week and at least 2 strength sessions per week as well. And this number, although it might seem daunting if you're just starting out or you're new to exercise, but you do have to remember that even with just doing 10 minutes exercise session, you will get health benefits. And if you aren't starting at 10 minutes, then you will be able to build that up over time. And physical activity comes in all different forms. So I'm going to talk a little bit about some of the ways that we can be successful in starting our exercise program. So our first step is looking at your intensity level. And this is just going off of as well what Francois was saying. I have a little scale here that we can also visualize. So how do you know you're working at the right intensity level, and how will you know if you need to scale it back or if you need to increase a level? So this is a great question, and it's really based on how you're feeling. So on this slide, you'll see what's called the scale of perceived exertion. And it's just a fancy way of saying, how hard do you feel you're working? So you'll see that 0 means you aren't working at all. You're feeling like you're resting. It might be how you feel right now, sitting in your chair, or if you're lying down, okay? And where 10 is maximal effort. So as seen in the picture, the last picture, the lady has her shoulders up to her ears. She's red in the face, and it looks like she's working quite hard to breathe. So when we're exercising, you're looking to be more like that middle picture. And that translates to between the 3 and the 5 on this scale. So that's moderate, somewhat hard, and hard. To know that you're at that level, now you may be a little short of breath and you may be sweating, but you should be able to carry on a conversation or a rough conversation together, okay? And if you're exercising, you feel like you could whistle or sing throughout the whole time, then you might be ready to increase that level a little bit. But on the other flip side of things, if you can't talk at all, that's too hard, and that's where you need to bring it back a level, okay? And by working at those right levels, you not only will gain those health benefits, but also feel accomplished, and that this is something that you can maintain long term. So our second step to success, and this is how you purse-lip breathe. So I don't think this is a new term to many people. I heard it on Caitlin's presentation, which she did last month, but we're just gonna reiterate it because I think it's a really important technique. So it's a breathing technique that can help us control our breathing. You can use it if you're in a situation where you're feeling your breathing is getting out of control. You can use it during exercise, or you can even practice it when you are relaxed. So the goal of the technique is to exhale twice as long as your inhale. And I'm just going to go through a scenario that I think a lot of people have experienced, and even for myself, for that matter, having asthma. So where you start to feel a little short of breath, and that starts to set off your panic. And then in turn, you become a little more short of breath, and now your anxiety is starting to increase a little bit more, and that's making you more short of breath. And likely at this point, our breath in and our breath out are very short and not very well controlled. So it's like hyperventilating. And to help recover from this situation, you need to stop what you're doing, sit, stand, or lean up against something that you can get support from. Breathe in through your nose and slowly exhale through pursed lips. So that's rounded lips, okay? And that will alone, the rounded lips will help slow down that exhale, okay? So just for us as a group to give it a try, I'd like us to do it without instruction and see how it feels, and then I'm going to go through a little bit more instruction, okay? So we're going to start with one breath. So important to sit nice and well in your chairs, good posture, okay? And as a group, if you can take a regular breath in through your nose and slowly out through your pursed lips. Let's give it one more try. Breath in through your nose, slowly out through pursed lips. Now I want you just to check in with yourself. Do you think that your exhale was about 2 times the length of your inhale? Just to keep that in mind, because that's what we're aiming for. And I'm going to do it this time by counting. So we're going to do 2 more breaths, but this time I'm going to count for an inhale of 2 with my fingers, and then I'm going to count for an exhale of 4. So doubling our exhale. So we're going to give it one more try. So I'll get you to take a breath in, breath out, good. So I hope that can help give you guys a try and practice that technique, because you can practice pursed lip breathing even during exercise, and that can help control your breathing. And this will make exercise even a bit more manageable, or get you out of those sticky situations if you're starting to feel like you're losing control of your breathing. Okay? My last 2 steps of success here is to start slow start low and progress slow. And this really it will prevent undue injury, excessive fatigue, and it also gives help to your heart and lungs and the soft tissue to adapt to the new movements and the new stress of exercise. It's also important to progress, like Francois was saying, that 10% rule of progression. So there are many variables that you can progress, and I encourage you to focus on just one at a time versus trying to progress multiple at once. So for example, if you're starting a walking program on a treadmill, I'd suggest you find that general speed that you're comfortable at, and then week by week do your 10% rule of increasing your time. So your time is that variable that you're changing. So focusing just on changing time versus going all in at once by changing the time, the speed, the incline. Because if you try and change too much all at once, it's not going to be very successful, okay? And we won't want to stick with it. So just trying to go start low and progress slow. And then the last tip today that I have is environmental factors are really important to consider. Now, avoiding exercise in environments that are likely to increase your symptoms, for example, and these are going to be different for everyone. Some people are affected by high humidity, extreme cold, extreme heat, poor air quality is sometimes some that affects people, and also strong winds. So try and identify those and what really doesn't work for you, and avoid those environments, or choose different times during the day that, maybe it's not as cold or it's not as hot to do if you are someone who wants to exercise outside. And then try not to exercise right before bed because this may interfere with getting a restful sleep. And sleeping is our way of recovery. And proper sleep hygiene, we call it, is developing good patterns before going to bed. And exercise right before bed might just get you too excited and then ruin that night's sleep. So it's important, not to choose maybe that time right before bed to be active. And then on the other hand, be mindful of the moments in the day when you do have more energy or you're feeling better, because those might be opportune times to capitalize on starting your exercise program during that time, okay? So what do you do if you find yourself in a flare-up of COPD? So firstly, you should decrease that exercise intensity or stop temporarily until those symptoms have resolved. You should also activate your COPD action plan if that's something that you have. And when you're ready to restart your exercise program, start by doing light physical activity as your symptoms improve. And don't set your expectation that you'll be able to resume your pre-flare-up physical activity level right after you've had a flare-up. You're really going to have to dial it back a little bit. And but the other thing I'd like you to not worry about is that, you will gradually build up that physical ability that you did have before. And if you're having trouble, I do suggest that you speak with your healthcare professional if you are unable to return to your physical activities following a flare-up or from your COPD, okay? And checking in with yourself, I heard Francois also saying this, so it is important checking in with yourself and reflecting how your body is feeling while you're exercising. Normal feelings during exercise might be that light to moderate breathlessness, you're starting to sweat, you might feel heat or leg fatigue, and these are common and not abnormal. So you can expect that you may feel this way if you haven't started exercising. But there are abnormal feelings, and some of these can include chest pain, intense joint pain, dizziness, heart palpitations, severe breathing problems, headache, or nausea. And if exercise brings on these abnormal feelings, then you should stop and contact your healthcare professional, okay? So barriers. When it comes down to it, there's lots of things that we can tell ourselves that might interrupt our regular routine of exercise. And I just put some examples on this slide that came to my mind at first. And you might, this might resonate a little bit with yourself. And so I'll just read through them. But some of them might be, I don't have time to exercise. I don't have any energy, or I'm lacking that motivation. Financially, I can't afford a gym or a membership. I may be fearful that I can get injured, or the weather outside looks bad, so I think I'll skip it today. So everyone listening, I'd like you to think of one barrier that might come up in your life that could prevent you from keeping a regular exercise routine. If we look at the evidence, the best way to not let barriers disrupt our exercise routines is actually to anticipate them. And these barriers, we can plan ahead. And this will allow us to successfully overcome barriers. So, for example, I don't know if anybody's talked about this, but some people may have a COPD action plan. And that's your plan in the event that you have a flare-up or that barrier. So with exercise too, I think it's not a bad idea to have a plan of action for some of the things that you might anticipate coming up during your exercise routines. Because although it might be hard for us to get started, it's not too hard for us to stop with exercise. So thinking of that, I did put together a little bit of a plan of action for one of them. And I'd be interested in our question and answer period if people have some other brainstorm ideas of how they could approach this and what they would do. So the one that I was thinking of is, it is winter weather now coming up, and so and decreased motivation to exercise. Those could be barriers. So winter weather is tough for those with COPD, and wind, cold, those environmental factors do affect people's symptoms. So I challenge you to think of what else can you do to be active? Is there a way that you can go indoors to a walking track? Or if that's not possible, is there a way that there's an open public space that you could go walking, like a mall? Or if going out is not a possibility, then what can you do inside your home? What resources do you have? Do you have opportunity to go on the internet and look up group workout videos? Or if you like dancing, is that something that you can put on some music, a timer, and then do your exercise that way? The opportunities are really endless, and this is where you can be as creative as you want. When in the winter months, lacking motivation is also something. It's not as nice out to get us outdoors. So brainstorm what keeps you motivated. And I'd be really interested to hear what some people can say on this. But I did take some notes from when I do a presentation with our other pulmonary group, and these are a few things that they have told me. So having a workout partner, even if they don't do the same thing, at least you come together, you're committed, and even if one person doesn't want to do it that day, the other person, you kind of end up joining and working your way through it. So having someone that you can even just do the exercise with. Setting your goals and really rewarding yourself when you achieve those goals, because that's important. And do something you enjoy, because if you hate the treadmill and then you make a goal of walking on the treadmill 3 times a week, then I can really guarantee that you will not be motivated to get on that treadmill. And instead, if you love to do yoga, then maybe sign up for a class online or whatever really interests. Heck, if you love cleaning the house, then set aside some time where you're doing that. Your heart rate will be raised for that period of time, and that is activity. Remind yourself that you are doing this for your own health, and therefore it is important for you to have that part of your life. And the last thing that people have told me is that they do enjoy documenting their exercise in a journal, and this alone can be very motivational for them because you look back at progress, and that boosts confidence and sense of accomplishment. So those are just a few of the things. I did have a even more list, but I didn't want to take up too much more time. And just take home points. So make exercise important, part of your daily routine. Take time to exercise and enjoy it. Start low, slowly progress, and that will help you be successful. Understand when you should stop exercising and seek medical help. So those were those abnormal feelings we talked about. Planning ahead will reduce the possibility of interrupting your regular routine when a wrench is thrown into your plans. And seek out your local pulmonary rehab team. If you're limited in your daily activities and you need support to start an exercise routine, speak to your healthcare provider to be referred to the local pulmonary rehab program. So that's my take-home points, and I hope that you were able to take something out of the session, and I'll hand it back over to Julia for questions and answer period.
Great. Thanks so much, Courtney. So if everyone's just patient with us